My background comes from a medical field, being a paramedic, and what I saw a lot of times is parents who don't have the resources, they don't have insurance, they don't have different, access to medical care, and so kids don't get care until it is an emergency, and they're calling 911 and they're trying to get, help either through an ER, through an ambulance, and so they let it go until it's so bad that it becomes an emergency situation.
We are excited about our partnership with Foremost because as a school, we can only offer education and some basic, just nursing services. But our partnership with Foremost is amazing because then we can offer dental. We've never been able to offer dental or behavioral health or medical health. Preventive care is huge in this neighborhood. There's a lot of people who go without, and then preventive care causes, or a lack of preventive care causes people to have to, they're sicker later,
It's not like it's out of the way, they're not having to drive somewhere else. They can come in, get their kids seen, do well visits, dental, the counseling, the behavior health. They can take care of all those things right here, and they know us, they trust us.
So I've been a registered nurse for about 23 years. I graduated in 1999. My initial start to my career was I worked at Baylor Medical Center, downtown Dallas, as a heart-lung transplant nurse. From there, I traveled abroad to Okinawa, Japan. I had the luxury of working with the naval, at the Navy Hospital, Camp Lester. There, I was a clinical nurse specialist for the labor and delivery unit. I'm currently still adjunct faculty at a nursing program in Houston. I started working here at Foremost Family Health Centers in October of 2017. I'm currently the Chief Nursing Officer. I enjoy working here, and along my journey, I just recently graduated about 2 weeks ago from Nurse Practitioner School at Grambling State University.
The most important thing we learned during COVID is that students who are out of school, they're not learning. And so if I can have a kid miss like half a period, then that's so much better than missing a half day. And so we can get them down here, their parents can bring them down here, they can get their problem solved and then go right back to school.
If you don't feel good, you can't learn. If you're sick and you're not able to come to school, you're missing important days. Right now, especially our kids they have the COVID gap. They have lots of days we missed because of COVID instruction that they've missed. So then you come into, if you're missing days because you have a sore throat, you have an ear infection, they're missing their education. They're missing important things that if you don't feel good, you can't learn. And so it just helps us to be able to take care of things immediately, get the kids back in the classroom so that they stay on target. We're not missing days, we're not missing and falling further and further behind.
Now, I've been in the Southeast Dallas community full-time since 1985. I've seen a lot of change in this community over the years. But the quality of the people, the quality of the families that are here in Southeast Dallas, I'll put up against anywhere else in the Metroplex. These kids deserve the opportunity to go beyond the borders that they have here in their community, to go out in this world and make a difference. And my hope is, for selfish reasons, that some of them come back here to Southeast Dallas and make a huge impact on the quality of life for all of those that live, work, play, pray, and go to school in Southeast Dallas. And those opportunities exist. And I'm so proud to be associated with this educational institution and for the partnership opportunity that we have with Foremost to make these kind of positive impacts in the community.
Well, the value of seeing family members, in addition to staff members, as you also asked, is that if we can start educating everyone, the sooner the better, and that's moving along the lines of prevention. So healthcare, for me as a nurse, is more on the preventive side. If we can prevent these things from happening, managing chronic diseases could come to a minimum. but we have to start early.
This clinic will entice parents to understand that if they have a need, and if there's any physical harm or anything that they need as far as illness is concerned, they have a place to go.
We currently have only one location, but as we grow, maybe we can have more locations to serve our 2,900 students and over 400 faculty members.
A healthy mind is a mind that excels. When you don't have food to eat, you don't have medical care, you don't have the services that you need, not only for the youth, but for the parents, it's burdensome. And here, with the opening of the A+ Academy Healthcare Center, we're going to meet those needs. And we stand with Dr. Belknap and her staff, as well as the Foremost Family Health Center Board of Directors, to continue to move forward. So whatever services we're able to provide, and we're going to go far and beyond. Ms. Tapley is one that goes after grants, and she secures those grants to provide the health care that we need to keep this center moving forward, and again, open up in other areas of the community where A+ Academy and her sister schools are involved.